Hi, this is Professor John with rnartline.com, and today we're going to speak on ICU Delirium. Let's start by looking at the word origin of delirium. Delirium comes from Latin, and it's broken down from de, or away from, and lyra, which is a furrow or a groove made by a plow. So its literal meaning is off the furrow, as in off the straight path, or out of the groove, or derailed from. Delirium originally describes states of mental disturbances and fever or madness, and it was adopted into medical English in the 16th and 17th centuries. So what is ICU delirium? It's an acute fluctuating disturbance in attention and cognition. It can be hyperactive, as in agitation, or hypoactive, or quiet confusion. And you can often have a mix of both. Unfortunately, it often goes underdiagnosed, especially in the hypoactive form. Risk factors that we need to watch out for are anyone above the age of 65, a pre-existing cognitive impairment, somebody who is on mechanical ventilation, sedative use such as benzos, infection or sepsis present, hypoxia, metabolic imbalance, sleep deprivation, this one's huge, immobilization, and finally alcohol withdrawal. What should we look out for? Well, signs and symptoms of delirium is disorientation, hallucinations or delusions, mood swings, inability to focus or follow instructions, altered sleep or wake cycles, emotional lability or flat affect, pulling at lines and tubes, such as in hyperactive types, and then a flat, quiet confusion in the hypoactive types. Assessment tools that we use are CAM-ICU, or Confusion Assessment Method for the ICU, ICDSC, or Intensive Care Delirium Screening Checklist, and finally, Richmond Agitation Sedation Scale, or RASS baseline for CAM-ICU. So be on the lookout for your patients who are showing signs and symptoms of delirium. We want to catch this quick and remove the offending factors as soon as possible. If you found this material helpful, please like and subscribe to see more. And if you need a nursing laugh or some illustrative study materials as a nursing student or ICU new grad, feel free to check out my website at www.rnartline.com. Love to see you there. Let me know what you think. And if you have any comments or suggestions on what notes I should produce next, let me know.